I'm Dr. Tayyab Afghani. I work as head of department at Al-Shifa Trust Eye Hospital, and my specialty is plastic surgery, reconstruction, and eye cancer. I will give you a brief on what we are doing for eye cancer in Pakistan. We started this Center for Eye Cancer back in 2021, and at that time there was not a single exclusive facility for eye cancer treatment in any part of the country. Still, at this moment, Al-Shifa Trust Eye Hospital is proud to have the first ever eye cancer center facility where we provide state-of-the-art comprehensive eye cancer control. There were challenges to begin with. We started with chemotherapy of all the surgical part of the cancer. We were already doing it. Our Consultant and Oculoplastics Center was doing the surgical part of the eye cancer for the last 20-25 years, and that is one of the most the sophisticated center in the country, and we were providing maximum number of care to these to remove the eye cancers, and then we started with the Center for Eye Cancer, which now caters for all the other treatments which we start after we finish with the surgery. Once you finish with the surgery, after the biopsy results come, and then you come to know what is the nature of the tumor, whether it is very lethal, is malignant, is a potential to spread, or how much life-threatening it is, how much is side-threatening, etc. So we started with the other therapies as well, and the first one was chemotherapy. Chemotherapy is a drug therapy for eye cancer, which is required for almost all the eye cancers once they are removed. And once we remove the eye cancer, we give them the drug therapy, which in the child, mostly it's 18% of these cancers in which chemotherapy is required are children. Right from the birth up to 5 to 6 years of age, this lethal eye cancer is affecting the children, and the statistics show that Pakistan has one of the highest prevalence of eye cancer in the region. So we provide them chemotherapy. Chemotherapy has usually 4 to 6 sessions, and each session lasts for at least 1 day. We provide the chemotherapy completely free of cost. It's costly, and it really needs resources, but we are, alhamdulillah, by the grace of Allah, we're providing it. Later on, at the same time, some of the cancers require radiation, or we call as radiotherapy. The radiation is actually needs radiation machine, and is very costly undertaking. There is, billions of rupees are required to establish radiation therapy center. So and the radiation, there are about 30 radiation machines in Pakistan, while the requirement is around 200. So there is a long waiting list, and by the time the patient takes its turn, the cancer might have returned to the surgery. So that was a major problem. But we worked on it, and now, alhamdulillah, we have made an arrangement with one of the premier institutes of the city, where they provide our patients free radiation, free in the sense that we pay them. Al-Shifa Trust pays all the cost of the radiation to that institution. We are on an empanelment arrangement. So alhamdulillah, we can say now that not only we are providing chemotherapy, but we are also providing radiation to our eye cancer patients completely free of cost. At the same time, this, as I mentioned earlier, we are aiming to be comprehensive eye cancer control. We also have set up a genetic lab which caters for genetic screening of the eye cancer. And then we have, after the cancer treatment is completed, the rehabilitation process starts. The process of rehabilitation in terms of restoring the function, restoring the anatomy, restoring the cosmesis. So we are also providing all these facilities. Recently, we have set up a static center for that purpose, which provides the cosmetic rehabilitation to all the complications of skin from radiation or chemotherapy. So in this sense, we are providing a comprehensive eye cancer control. So far in the last 2.5 years, we have undertaken around 2,500 chemotherapy sessions, and dozens of patients have got treatment for radiation free of cost. And there are about 4,000 cancer patients have been examined, and out of which these were the people who were treated. And these mostly comprise children, and there are stories which I started sharing with you. It will be difficult to hold back your tears, but we are, alhamdulillah, we are trying our best. And despite the challenges, despite the cost, despite the resources restraint, alhamdulillah, we are providing all the treatment completely free of cost. And inshallah, we will keep on providing this with the help of Allah subhanahu wa ta'ala and with the support of all of our donors, supporters, friends, etc. Thank you very much. Assalamu alaikum wa rahmatullahi wa barakatuh.